everyone. We're here at the EULAR 2026 Congress in London. My name is Wendy Wagenaar and I'm a patient research partner from the Netherlands. And I'm very happy that Jeanette Andersen is joining me today. You are a patient representative from Denmark and also, more importantly, maybe even the chair of Lupus Europe. Thank you very much for joining me today.
Thank you. Thank you for inviting me.
Of course, it's my pleasure, actually. So yes, we're going to talk about Lupus GPT, which is a tool that you created. Can you tell us a bit more about what it is and what is benefiting for patients?
Yes, of course. So I'm very happy to talk about it because we're very proud of the tool. It's a multilingual information tool created for lupus patients specifically. It's created with patients, it's created with physicians in collaboration, and also with AI experts, of course, because we are a patient organization, we are not AI specialists, so we needed help to develop it. It's answering questions about lupus in an easy to understand language. In your own language. So you can ask it anything you would like about lupus. The good thing is it's a curated library behind it. So it doesn't work like a normal large language model would. If it doesn't know the answer, it would tell you, I don't know the answer because the answer is not in my library, which also means it will not give any false answers. It will not ghost and go outside the tool. It will stay inside the tool and only give the correct answer, which means you can trust the information you get. So I think that's a really, really big benefit as a patient. You can be sure that what the information you get from that instrument is accurate.
It's amazing, I think. Thank you for sharing.
Thank you.
You mentioned it already a bit, but there are, of course, with AI, more challenges. You mentioned misinformation already, but I can also mention, for instance, privacy.
Yeah.
Were there more challenges like this, and how did you address them when developing Lupus GPT?
So one thing that was very, very important for us was privacy. Making sure that we had no GDPR breaks of any kind.
Exactly.
So the tool is completely open. You don't log in. You don't have to put in your name or anything. It doesn't capture your IP address. It doesn't register who you are. And we also discourage people on the front page to put in any personal information, because that's not what the tool is for. It's not a medical tool.
No.
It's a tool that gives information, and that's all it is. And that really helps us a lot, because that makes it easier for us to make sure that people are not identified when they use it. It doesn't capture the questions. It captures themes that people are asking about. So we have some keywords, which is already in there. So like pain, for instance, is a keyword. So when someone asks about pain, we know, okay, someone was asking about pain and how many did that. So we know this is a topic that's really popular and people are interested in. It also captures the questions that it doesn't answer. So when you have a question where you didn't get an answer, we get prompted. So we know to put in that answer for next time. It really helps us a lot. And we've already developed the tool from that, expanded our library, making sure that we have more information. We saw that many patients were asking about pregnancy and family planning. And we realized we had some information, but not enough. So we actually collaborated with physicians, experts in pregnancy and lupus, and they helped us develop good information material we could put into the tool, and now it answers those questions which it didn't do before. But you're right, it needs to be safe, it needs to be secure. We're also very proud that it's open, so it's no subscription, you don't pay anything. We pay a very, very small fee for each question that's asked, but it's not much, so it's our pleasure to do that. And that's it's easy to use.
That's very cool, and also very cool that you keep on developing it in a certain way. Yeah, it's very nice. I can imagine that for a specific other diseases, they might be interested in developing something similar.
Yes. Yeah.
So based on your experience, do you have any advice for other people who might want to develop something like this?
We get approached all the time because we were the first ones who did this, right? So people are so interested in learning about it. The thing that we always say is don't start thinking about an AI, start thinking about information material. Do you have the documents that's supposed to go into the library? So trusted, valid documents that are approved both by physicians and by patients. That is the start. And as a patient organization, you already have many of those documents. You already have all the information about what it is to live with that disease. So make sure you have that library of documents, and then you can start thinking about creating an AI tool. Also, very importantly, consider privacy. Consider how you want the tool to work. What is the function of the tool before you actually go into it? And then contact a really good AI company to help you, because you don't need to be experts yourself. Use someone who is an expert.
That makes sense.
It's
Thank
easier
you.
than you think.
Yeah, thank you for sharing that. I think that's very helpful for
Yeah.
everyone who wants to do something similar.
And of course, if people are interested, we can send information. And
that's
they
great.
can contact Lupus Europe Secretariat, and we will help them.
That's very nice. Thank you. Now, as a final question, because you might have some knowledge about this as well, looking into the future, what do you think is next for tools like Lupus GPT in the upcoming years, let's say?
Yeah, as the world is moving really, really fast,
Yeah.
and AI is moving incredibly fast, and the world is changing all the time, and we need to change with it. And I think we need to just accept that patients are using AI. So let's make sure that the information they find out there is trustworthy. And that's where a tool like ours is so important. I think, so what we did, we kept developing our tool, as you said. We also developed what we call Easy Lupus, which is the next step. So for those who are not as literate, not only health literate, but literate as well, it has a language of around a 10-year-old person. And it doesn't have all those technical medical terms as well. So it's easy to understand. In that functionality, we right now have a beta function where you can actually ask your question out loud in any language you would like. So, and then it reads the answer out loud to you. So that's even more, I think, accommodating those people who don't read and write that well, or who have difficulties seeing, or who have difficulties with their hands using the mobile phone. You can just scan a QR code, ask your question, and get the answer read out loud to you. And we have right now people from 189 countries who are using our tool. It was actually developed for Europe, and it's approved for Europe, but people are using it all around the world because it works in all different languages. So we know that it works in Africa, in the African languages. It's incredible. I mean, this has gone far beyond what we thought. And of course, moving forward, we are very aware that we need to keep on top of the development and also put in new documents. That's very important. The library has to grow all the time because what people are asking about today is not the same that they're going to be asking about tomorrow. But I think AI is here to stay. And it's going to be used both in the medical world for really beneficial ways, but also for patient information, I believe. And that I think is going to be the future.
Yeah. I fully agree. I think it's so great. Thank you for sharing this.
You're very welcome.
I'm very much looking forward to see where it develops. I think
I'm as well.
Future, yes, I can imagine. Thank you very much for sharing and be with us today.
You're welcome.
Thank you. And of course, thank you also to everyone who's been watching. I hope you have a great the rest of the Congress here in London. Thank you.